Our team members take pride in our roots. We grew up on farms, we live on farms, and we serve farms every day. At Armor Animal Health, our veterinarians help you detect diseases through our state-of-the-art lab. Our pharmacy then helps deliver the right solutions to keep your herd healthy. With locations across the United States, we have the ability to supply thousands of products to your door. When you kick off your boots at night, know that defending your herd isn't our job, but a way of life.
Hello, everyone, and thank you for joining us this week on Have You Heard? Armor Animal Health video series. My name is Dr. Vicky Lauer. I'm a professional services veterinarian with Armor Animal Health, where I've been working for over the last 7 years. I live in central Wisconsin with my husband, who is a farmer, as well as our 3-year-old twins. I also have a small dairy goat farm that I run myself. So yeah, I keep plenty busy in my personal life as well. But we would like to know where you all are from, so please share in the comments below. It looks like we have people coming from northern Vermont, some from Washington State, and then Waunakee, Wisconsin as well. I don't know about you, but it is snowing a lot here in central Wisconsin, so hopefully you all stay safe and can enjoy the snow from the safety of your home or the inside of your car. Today, I will be sharing a video of how to do a necropsy, or also known as an autopsy, on a calf. Now, I recorded this video in the fall on one of the farms I work with. While we try and do absolutely everything we can to prevent an animal from dying, unfortunately, death does happen on a farm. Figuring out the cause of death, though, by doing a necropsy provides vital information to improve the health of the rest of the herd. Now, if you have a queasy stomach or are bothered by the sight of blood, you might want to skip this episode. Otherwise, please watch the video while you're sitting down. Make sure you're nice and comfortable. If you have any questions throughout the video, please ask in the comments below. I will go through all the questions after the video is over and answer them. If you're watching the recorded version, you're still welcome to ask questions, and we will get those answered later. Without further ado, let's jump right to the necropsy video.
Hi everyone, my name is Dr. Vicky Lauer. I'm a professional services veterinarian with Armor Animal Health, and today I am going to show you how to do a calf necropsy. Now, necropsies are one of those things that are quite easy to do once you're trained. If you have field dressed a deer, then you can certainly necropsy a calf. And you get a lot of information from these animals. Unfortunately, they are dead, so they can't really do much more for us in life. So if we can find out what caused that death, then we have a little better answers. Because a lot of times we're surprised by the cause of death. For instance, I'll see calves where they're bloated up, and you think, okay, maybe this is Clostridia, and we need to start working on making sure that all of our feeding times, temperatures, mixing, that's all consistent. You open them up, do a necropsy, and find out, oh, actually, it had a mesenteric torsion. So that's where the intestines kind of flip around themselves, right where the aorta is, and that's just bad luck. So it's a good way to find out what's going on in those calves, give you a definite answer versus just guessing that, well, I think it was pneumonia, well, I think it was this. And then, of course, if there are issues going on the farm, you can take samples from these calves and send them to the diagnostic lab and get even more specific answers. But a lot of times you can find out the cause of death just from doing a necropsy, not taking any samples. It only takes about 15 minutes of your time, so it's a pretty good return on investment for the information that you gather from a dead calf. So what I do when a calf has died, I start with the outside first to see if there's anything I can see with my eyes just on the calf. So this particular calf, I can see he's got a little bit of some eye boogers here on his nose, or on his eye, sorry. His nose is okay. He's skinny, his eyes are a little bit sunken in. And then I look at their joints to see if there are any swellings in the joint that would indicate a previous navel infection. I do feel the actual navel itself. A normal navel is going to be the size of your pinky or smaller. If it's larger than that, then that indicates that there was a navel infection. This calf, it's definitely smaller than my pinky, so navel isn't an issue. Then continue to work my way back. I'll feel along the legs, feel if there are any bubbles under the skin. Those bubbles would be more indicative of blackleg, which is a clostridial cause of death. And then feeling those joints, and then looking at the butt, basically at the tail. So this calf had quite a bit of diarrhea. You can see it on the tail, you see it on the legs, so it was a longer ongoing process with this calf. So once I've looked at everything externally, then I'm ready to start my necropsy. For supplies, basically a knife, a nice sharp knife, and then if you are going to take some samples, just some regular Ziploc bags. They don't have to be fancy, but put the date on them as well as your farm name. Again, you don't have to take samples on every single animal. On this particular calf, though, we want to find out why it had such bad diarrhea. For doing the necropsy, you just grab your knife and you're going to make a cut between the body wall here and then the front leg. And so for this, the skin and the hair is what dulls your knife more than anything else. So you do more of a stab incision. So you poke right on through, and then you're going to extend that cut with your knife, so that basically that leg is going to fall back. For some reason I wanted a blood sample from this calf. You can usually get it from the vein right in the front leg there. And then I'm going to come around to the back leg. I'm going to do the same thing. So I'm going to pick up this leg. Now the abdominal cavity is here. I don't want to pop into the abdominal cavity because then I'm going to have guts and fecal material contaminating everything. So you want to kind of keep your knife closer to the leg, and again, you just pop that knife right through, extend your incision both ways, and then the hip joint is going to be right here. There's a little ligament that connects it. You just cut that ligament, and then it pops that hip right out of place. So now it's very easy and open to work on the calf. And then what I do is I skin the abdomen simply by pulling up on the skin and the hair, and then just continuing to cut. And there are lots of different ways you can do a necropsy. This is just Dr. Vicky's way. All right, so now that calf is nice and open, I can see basically everything. Nothing is in my way. Next part we want to do is actually open up the abdominal cavity and the thoracic cavity. So to do that, I'm going to come in front here so hopefully you can see a little better. On calves this age, there are basically the junctions between the ribs here and the sternum. They are cartilaginous, so they're very easy to cut through with a regular knife. So I am just going to, you can kind of see that cartilage right here going up into the bone, and I'm just cutting right into the the thoracic cavity, and then I'm going to extend that through my abdominal cavity like so. And this way I can see inside the calf. And then what I do next, because we want to actually get to where we can see the lungs, I am going to cut between the ribs, hopefully. I'm going to cut the diaphragm here, which is separating the abdominal cavity from the thoracic cavity, like so. And then I'm just going to hopefully pop and break the ribs. So now everything is open and clearly visible. Now if you're doing this on farm, this would be a great time to take a picture of what you see right here before you touch anything, and then you can send pictures to your veterinarian. Most veterinarians are just fine with looking at pictures in the digital age. We're used to that. And sending a picture of everything open, we can get a good feel for what did this calf look like before we start digging into it. Just for some identification, these are the lungs here. They're nice and pale pink. They are spongy, which is what we want. This is actually looking like a fairly normal lung, actually completely normal lung here. The heart is here. This is the spleen. On a baby calf, the abomasum, or the true stomach, is what's taking up most of the space. This calf is about 4 weeks old, so it's still mostly the abomasum. This is the rumen here, and then this would be the reticulum. Then we have the intestines. So all of this is small intestines. These are the large intestines here. This is a kidney. The kidney on cattle is very lobulated, so it looks funny. One thing I look for is how much fat is around those kidneys. We're looking for kidney fat. We'll also look for fat on the heart. And then if you kind of dig a little further, here's this little tiny bladder. You didn't have much pee. But one thing I'll look for on a younger calf is that this right here connects the bladder to our umbilical cord right here. Now this is very, very tiny now because this is an older calf. But on a 1 or 2 week old calf, this will actually be quite large. And I want to see if that's infected or swollen at all. Underneath the stomachs, we have the liver here. And then you can see the other connection between the liver and the umbilical cord. So that's, again, something else I'll look for that is normal. His gallbladder is kind of hiding right here. For a calf that hasn't eaten in a while, the gallbladder will actually be rather greenish. It's just kind of a soft, fluid-filled structure. And yeah, if I see green, I know the calf hasn't been eating. This calf has been eating okay. So that's basically what I'm going to look for. Now with the lungs, there are 2 sides of the lungs, so I am going to want to look at the other side. There is a sac surrounding the heart, which I just kind of cut through, and then I'm going to look at the lungs on the other side as well. You can use your knife as a handy dandy little scraper. These are just some blood clots because this calf is very recently dead. So you can use a knife to kind of scrape away the blood so you can see. But yeah, these are nice, normal, healthy looking lungs. Now lungs that are diseased, so with pneumonia, they will actually be about the color of liver. So it's a good comparison. So if I kind of squeegee away some of this blood here and pull out the liver, you can see how dark the liver is compared to the lungs. So if your lungs are about as dark as your liver, that would be abnormal. That would be a sign of pneumonia. If I were to be taking samples, I want to sample anything that looks abnormal, especially. So if this calf did have, say, some dark spots on the lung here, then I would cut off this section of lung and send this to the lab for testing. For me personally, when I am sending samples, I sample everything because this calf is dead. If I want to get an answer, sometimes I get an answer from unexpected places. Like salmonella is one of those great pretenders where we might not find it in the lungs, we might not find it in the intestines, but we can find it in that gallbladder that I showed you. So yeah, if I'm taking samples, I'm going to take samples of everything. So I said I look at the heart fat. This calf has kind of been struggling for a while. So there's not a whole lot. There's certainly some fat here, but it's kind of soft and squishy. And when it's soft and squishy, that means that the calf really hasn't been eating very well, which fits with what we saw with this calf. All right. Now, I am going to actually take samples on this calf, so I will get my little baggies out and I'm going to show you how I sample. I like to have 2 to 3 bags. They're just regular old Ziploc bags, again, nothing fancy. And first we start sampling all of the non-guts. So no stomach, no intestines, basically all of our major organs besides the GI tract. So I said I'm just going to take a sample of lung. If there's something abnormal, I would take a sample of that. I'm not seeing anything abnormal, so I'm just going to take a section here. I'm going to put the lung in a bag. I will take another section from that downside of lung just to be thorough. Then I'll take a section of the heart. I actually usually just typically cut the whole, remove the whole heart itself, so then I can see the whole thing. So both the ventricles and the atria there. For sampling, I'll just kind of cut off the bottom part of the heart like so. When a lab tests these samples, they're going to do some different testing. So they're going to try and culture. And for culture, the bigger your chunks, the better. They're also going to do some DNA testing to see if they can find some dead bacteria. For that, small sections are just fine, and they'll get those small sections from these big sections. And then they also are going to look at all the different organs under the microscope. And when they're looking at those samples under the microscope, they need teeny tiny little samples. So if I was gonna send some in a formalin jar, I just take off a tiny little sliver, like so, from that area that I cut. So you can see it's not very big. This is all the lab needs for looking at under the microscope. So I'll do several different sizes and sections of the different organs for them to test. So I'm going to put the heart in the bag with the lung. Then I'm going to take the spleen. Usually I just kind of cut off a small portion of the spleen. The spleen kind of has this, some people call it a jam-like appearance. This is a very normal looking inside of the spleen. It's firm. It has kind of these little white striations in there. That's normal. I'll take this, I'll put that in that same bag. And then I'm going to take a section of liver as well. The liver looks nice and normal from everything that I can see. It should be this brownish color. It's going to have these little pores in there. That's where basically all your different enzymes are going to be emptying in, as well as your blood vessels. So again, just a chunk of liver that I'm going to put in the bag with my other non-GI. And then I am going to take that gallbladder that I showed you. Right here, this little guy. It's just kind of a blind pouch. So it's a little slippery. Lock the gallbladder. Sometimes it's easier with the scalpel, but you certainly do not need a scalpel. It's just a slippery little guy. There we go. I'll put the gallbladder in there. And I'm going to come and remove one of the kidneys. They do have 2 kidneys. And with the kidney, what I will do is I will actually cut into it. It's a very sharp knife. Be careful while you're doing that. Ideally, you should cut it on the ribs so you don't cut your hand. It's a very lobulated kidney. You'll see different colors, so kind of a browner color here and then a little redder color there. That's normal. If you see a whole bunch of little tiny red spots all speckled throughout, that is not normal. That would be more of a septicemia or a blood poisoning. So that's something I look for. As far as the section goes, I'll usually just kind of take about 1/3 of the kidneys and put that in my bag. And then that's basically it for this bag. So these are all my non-GI contents. Then I'm going to move on to the GI contents. So this calf had diarrhea. We are concerned about an intestinal issue. We weren't really concerned about any lung issues. So I'm going to take lots of different samples from the intestines as well as the rectum. And I'm also going to look pretty closely and see if there's anything abnormal. So this calf has some odd red spots. Don't usually see that. There are a lot of lymph nodes. So these are the intestines here. These are the lymph nodes. I like to try and sample them because we can get some good info out of those as well. The small intestines look pretty normal to the naked eye. The large intestines are here, and they're a little gassier, a little more fluid filled than a typical calf, but nothing that's really standing out as, oh, this looks scary. Honestly, this calf is looking pretty normal in general. That's why we're going to take samples to find out what's going on. And this is the rectum here, which you can always find because it connects to the outside. And there are some large lymph nodes there. So for sampling the intestines, I'm just going to hold on to a section of the rectum. I'm going to grab it. There's usually some poop in there, some fecal material, so I'm going to put that in a new bag. So all my GI contents are going to go into this bag. I'm going to take a section of the small intestines with a good chunk of these lymph nodes. That's about the typical size of what I will take. You can do what's called a ligated loop as well, where you would tie off this section here with just some suture material, or I've even done it with baling twine if I had to, and you tie off another section here and then cut that off and send this portion to the lab. I'm not going to do that in this case because I don't think we really need to. Okay, then for the large intestines, again, just kind of take a good sized chunk. I'm incorporating quite a few lymph nodes. You can see kind of some nasty poop. All my lymph nodes are there. This is going into that GI bag. This here is the cecum. It is a blind pouch, so it's pretty easy to identify. So I'm going to take a sample of that as well. Again, just kind of hold on to the end, cut a section off, put it into my GI contents bag. And that's it for my intestines. Now I'm going to look at the different parts of the stomach. So this is the rumen. Now on a calf that's eating more grain, or an adult animal, the rumen is going to be full of a bunch of feed. This calf just kind of has some various and sundry ingesta. It's got some straw in there, a little bit of grain that he's kind of been eating on. It's pretty frothy, but that's because he's still fairly young. I like to look at the rumen papillae. So the papillae line the inside of the rumen. On an older animal, these are going to be very carpet-like. This calf is still young. He really doesn't have much rumen development. He's not been feeling good for a while, and so I kind of expect that there's not going to be a whole lot. I'll try and clean this off so maybe you can see just these little carpet-like coverings. So yeah, so that's the rumen. For the rumen, I'm gonna just take a sample like so, put it into my GI bag. I always save this for the last because it's, always nasty and runny, which is why we take all of our other samples first. Okay, we will look at the reticulum just so I can show you what it looks like. The reticulum is also kind of a blind-ended pouch. It has this honeycomb-like appearance. On an older animal that is ruminating, this is going to be covered with those same papillae as the rumen, but it has a really neat appearance with those honeycombs, so you always know where you are. Just going to take a little sample of that. And then the omasum is going to be under there. The omasum is kind of like a firm ball. They call this the butcher's Bible. Again, because on a more developed animal, there are going to be a whole bunch of different, it looks like leaves on a page. So you can see these different layers here and there. And that's the omasum. There aren't a whole lot of things that go wrong in the omasum or the reticulum, but every now and then I'm surprised at something the lab finds, so I still do take samples. And then last but not least, the abomasum. And this calf is still on milk, so I'm gonna kind of empty the bulk of the milk out of the abomasum so I can see inside. One thing that I'll see fairly commonly in calves, especially ones that have been treated quite frequently, is they will have ulcers, and so that's one thing I'm going to look for. He kind of has this various different colored stuff in the mucosal lining. Ones I've tested, I've not actually found an answer for what that is. We used to say BVD would cause that, and all the calves I've tested have been BVD negative, so it might just be something that he ate. The inside of the abomasum is going to be kind of rugged and folded like this calf is. This is looking normal. I'm not seeing anything that stands out as unusual. It actually looks pretty healthy. So I'm just going to again take a sample of the abomasum. If there were a stomach ulcer, then I would sample that ulcer or any other part that looked abnormal. So sorry I didn't get to show you anything really exciting on this calf. Like I said, looks pretty normal, but hopefully we're going to get some answers from these samples and find out why this calf had such long-lasting diarrhea. For diarrhea, basically the intestines are going to look the same no matter what the cause is. So for a diarrhea case, I'm going to be taking samples because I'm just not going to get an answer from a gross necropsy like this. Pneumonia, we can get some pretty decent answers just from a gross necropsy. All right, I hope you enjoyed watching this necropsy, and yeah, have a great day.
Thank you all for watching that video, and I hope you found it valuable. Now, we did get some answers from sending samples to the diagnostic lab, so that was good, and it's definitely changed how we treat calves with similar long-lasting profuse diarrhea such as this calf had. I also want to mention timing of a necropsy. So I didn't talk about it in the video, but it's important to do a necropsy on a calf or any other animal as soon as possible after birth, definitely within the first 24 hours. In the summer, it gets really hot, especially a ruminating calf. They're going to generate a lot of heat in that rumen, and that's going to cause the tissues to degrade a lot faster. So in the summer, definitely 24 hours from death or before. In the winter, because it's so cold, small calves will actually freeze pretty quickly. So in the winter, we could go a little longer than that 24 hours. It makes it a little more challenging when they are actually frozen. All right, it looks like we have some questions from our viewers. So let me hop on over and take a look at those. So Steve is asking, what Armor Health product do I recommend for scours? Steve, that's a great question. Now, because there are different causes of scours, so there are viruses, there are bacteria, and there are parasites that typically cause scours in these young calves, there's no one product that's going to treat all of those, except potentially electrolytes. So electrolytes are going to be the basis for scours treatment, because we want to try and keep those calves hydrated and rehydrate them if they are getting dehydrated. Signs of dehydration are going to be eyes that are sinking in, skin on the neck. When you pull it off the neck, it'll tent, it'll stay up. So with that, electrolytes. There are some really good electrolytes. Some of the best on the market are going to be the Blue Light Replenish M, Cheers, there's Epic Electrolytes. Those are all very good products. For everything else, if it is a bacterial scours, it's going to depend on the bacteria, what we treat them with. With the different parasites that can cause diarrhea, they're a little more challenging to treat, and we just don't have very good options for them besides feeding calves more milk and keeping them hydrated. That was a good question. All right, it looks like Brenda is asking about, do I worry about any contamination when I put all the GI samples together? Another good question. So the GI tract is all connected anyway, and because I take those nice big samples, when those samples get to the lab, what they're actually going to do is they're going to sterilize the surface. They're going to cut into that sample and swab it. So as long as I have nice big chunks of tissue, it really isn't going to contaminate any of the other samples. And then with the GI tract, bacteria that are in the abomasum are typically going to be in the intestines and kind of vice versa. So no, we don't usually worry about any contamination from that. But that was a good question. All right, Amy asked, how much did all those samples cost? So for doing the actual necropsy, for me as a veterinarian, we charge just basically on the amount of time. So it typically takes me maybe 15 minutes to do a necropsy. So we charge based on that. Now, sending those samples to the diagnostic lab, that's going to depend on the state that you live in. So here in Wisconsin, you can do what's called a bottle necropsy, which would test all of those samples that I tested. And that costs a little over $130. So you get a lot of bang for your buck. Now, other states have different testing procedures, testing prices. So it's very important to work with your veterinarian, find out what samples should be taken, what that lab prefers. Good question. Okay, Heidi asked, was I able to determine a cause of death in that calf after the lab results came back? So yes, it ended up being a very odd bacteria that is seen most commonly in poultry. I did find a couple cases where they are seeing it in calves. So it's kind of maybe a somewhat new or emerging disease. And then we did find out which antibiotics would work on that particular strain. So that helped us change what antibiotics we were going to use on cases that looked similar to that in the future. All right, let me see if we have any more questions. All right, Lance is asking, what is the turnaround time to get typical lab results? Good question. So for that bacterial testing, that PCR that I talked about, the lab is going to give us some answers in typically 2 to 3 days on the PCR. So it's very quick. Culture is going to be about the same. So as a veterinarian, I can get some preliminary results in about 2 to 3 days from when the samples actually get to the lab. Now, for when the pathologist is looking at samples under the microscope to see what sort of changes have occurred in those cells, that's going to take a little longer, but that will also depend on the state that you're sending them to. So here in Wisconsin, sometimes it'll take a couple weeks before you get kind of the full diagnostic results back because you're waiting on those lab changes from the look at under the microscope. Some states I know are maybe a little quicker, so it just depends kind of how many pathologists they have working there. Good question. All right, I think we have another question coming in, so hold on. All right, nope, that's it. All right, so it looks like that's all the questions we have for today. So hopefully you learned some of the benefits of performing necropsies on your farm. As you can see, it's pretty quick, pretty easy to do once you're trained, and something that can help your veterinarian and you get some more answers. Please feel free to share this video with your friends as well. Now the video has been recorded, so you can go back and view it either on our website at armoranimalhealth.com/haveyouheard, or you can see it on our Facebook page as well. If you're watching the recorded version and have a question, you can ask in the comments and we'll get those questions answered for you. And please let us know if you have any suggestions for future Facebook Live topics. Also, I'd like to shout out Vicky Schultz of Schultz Brothers Dairy in Freeman, South Dakota, who is the winner of the Winter Keyword Giveaway and recipient of the $250 gift card. Congratulations, Vicky, and thank you for watching. Finally, we look forward to seeing you in 2 weeks for our next Have You Heard episode with Wayne Kyle and Rob Costello with Milk Specialties about the science of mixing milk replacer. Thanks, everyone, and have a great day.